red flags with plastic surgeons. If you're seeing a plastic surgeon and you don't perhaps meet that plastic surgeon, that doesn't have to be a red flag, but you're kind of getting into the red flag zone. Some practices will have you meet the surgeon the day of surgery. That's a real red flag.
A couple of the key things that you want to know is, number one, is the surgeon someone who's obviously board certified? So that's a big push, that we want to make sure that surgeons are properly trained to be able to take care of patients. The second is, does that surgeon have hospital privileges? If you're doing surgery in an outpatient setting, is there a place to go if there is a problem? Can they take care of you, or are you just get stuck, going to the ER by yourself? Third is, how often does your surgeon do those procedures? For example, rhinoplasty, very, very high complex operation. You want to make sure that you go to a surgeon that does lots of rhinoplasties. Vaginal rejuvenation. There's a lot of physicians out there that are trying to do a few different procedures, but maybe they're not really comfortable. They don't have a lot of training. So you want to really go to someone that's focused on that area, someone that is really comfortable, confident with the anatomy, and can really help you out.
If you feel like you're being pressured to add in more procedures on top of the procedure you came for, while we talk about that all the time, and lots of our patients come and then things get added on, we're never pressuring anybody to do that at all. And if you feel like somebody is really pushing a certain agenda, that's kind of a red flag too. If a surgeon tells you that they want your implants to be a lot bigger than you wanted for reasons like it will make it so you don't need a lift, there is a small amount of truth to that, but very small. It's much better to just have the lift that you might need and get the implant that you want so that you're the size you want to be and look the way you want to be. Don't be talked into things, I think, is really the take home.